If you are a professional working with alcohol or other substance use disorders, you will most certainly have come by patients that seem resistant to the help you or other facilities are offering them. You may find that these patients might try to trick you, manipulate you, or get verbally or even physically aggressive for the most mundane reasons. They might also use to get in trouble more than other people and have flaming conflicts with their families, neighbors, employers, teachers, as well as the police and other public authorities. They might be very impulsive, act irresponsibly, and lack the ability to respect other people's boundaries. These patients might be having what is called Antisocial Personality Disorder, or APD for short. Now, why is it so important to have this disorder in mind when working with patients with addiction? Let us look at an example. This is Jeremy. Jeremy is a 22-year-old man. Because his mother was using drugs heavily, he was placed in custody throughout his childhood. When he was 14, he ran away from his foster parents and has been homeless ever since. Now, at age 22, he is still living on the streets, smoking cannabis most of the day, has no job, and lives on social welfare. Jeremy is sleeping rough most nights, stealing things that he can sell to make extra money, and will occasionally also steal things he needs, such as clothes and food. He has been arrested a couple of times, but finds this greatly unfair and hasn't changed his behavior. Most of his friends are also taking drugs and are tired of Jeremy always asking them for money without ever repaying it, which causes a lot of conflict. He has also been diagnosed with ADHD, though he does not take his medication, but sells it instead. His contact with social and mental health services has nearly always been negative, and he repeatedly finds himself bewildered over why his requests are not granted at the time or in the way he needs. Jeremy is a huge challenge for social and mental health services. He obviously is in need of help, yet it is very difficult for him to collaborate with the professionals that are trying to help him. Jeremy clearly has resources. He is able to organize places to sleep, he managed to get welfare benefits from the state, and to get a diagnosis of ADHD. However, his attempts at getting his life back on track never last very long. Although Jeremy has been diagnosed with ADHD, his problems go much further than the difficulties in attention and impulsivity that are related to this disorder. He has very significant difficulty with regulating his anger. He is consistently dishonest and does not fulfill obligations. He has interpersonal problems and difficulties following social norms. These difficulties lead him into actions that end in conflict, offend others, produce violence, and break the law, which sometimes ends in arrest. In short, he very likely has APD, and simply providing him with standard treatment for his cannabis problem and medication for ADHD would do little to solve his problems. Studies have shown that approximately 1 to 3% of persons within the general population suffer from APD. Within the population of people with alcohol dependence, this number rises to 20%, and within drug dependence to 40%. Persons with comorbid APD and substance use disorder commit a great deal of the crime and violence in many societies, usually leading to punishment and imprisonment. Yet, this approach very rarely leads to long-lasting success, and rather increases the frustration and feeling of being excluded from society. So, how can we acknowledge and deal with this kind of personality characteristic or disorder in a more sustainable and supporting way for the affected person? The Impulsive Lifestyle Counselling Manual offers such an approach. Instead of punishing and excluding the patient from social services and society, it offers a way to make people with coexisting APD and substance use disorder understand how their behavior can lead to the negative reactions and events they are experiencing, and how a change in this behavior can also change the outcome of situations and interactions with others. The program is based on the criminal lifestyle theory by Glenn Walters, explaining the 4 areas in which impulsive and externalizing behavior can show itself. It mostly uses psychoeducation besides small tasks and exercises which help the patient to understand his way of living and acting towards others. The professional and the patient together explore and talk about the patient's behavior and values throughout 6 sessions. To get a closer look into how the counseling program works and which topics it covers, look into the following video.